Hello everybody, I am Claudio Cerchione. I work in Istituto Romagnolo per lo studio dei tumori di Amadori, located in Meldola, northern part of Italy. And I'm really happy and honored to do this interview for HealthTree, which I particularly consider as a refer for patients worldwide. And I think that it's really important to focus on what we have learned from EHA and ASCO 2024. The revolution in multiple myeloma is continuing. We have many novel agents, many new combinations, and it is an incredible moment also for diagnostic tools that are becoming really important for optimizing treatment. Particularly appreciated the new data about frontline treatment. We are going to have many new options. Monoclonal antibodies, daratumumab and isatuximab are the backbones. The partners are changing, VRD, KRD, many new options to be added to the monoclonal antibodies. I think that data are exciting. The new endpoint is going to become the MRD negativity. Sustained MRD negativity is something that we should aim to reach for every patient in which we have an intent to treat. And I think that this data, also considering the ones that are going to improve the maintenance, thanks to the addition of CAR-T to the patients that have performed autologous stem cell transplantation, are something of really important that we take home from this important conference. What about relapsed refractory setting? At first, there is a reawakening of belantamab mafodotin with two incredible trials, DREAM7 and DREAM8. I am honored to be one of the authors of a New England Journal publication of DREAM7, in which belantamab has been compared to daratumumab, belantamab bortezomib dexa versus dara bortezomib dexa, and I think that we can see, if we anticipate a earlier line belantamab mafodotin, it is incredibly in synergism with bortezomib. Data are exciting in terms of effectiveness, but also tolerability. The ocular events are really rare, are really manageable, and I think that we are potentially, considering the progression-free survival, the very good patients-reported outcomes, we are in front a potential new standard of care, particularly in lenalidomide refractory patients. Lenalidomide refractory patients that in this moment constitute a little bit an unmet clinical need, and that's why I focused also about the preamble registry data, in which I was first presenting author at EHA 2024, in which we have found that overall response rate after refractoriness to lenalidomide is about 31%. We need more in these patients. One option could be DREAM7, bela-bort-dex, other could be DREAM8, belantamab pomalidomide dexamethasone, but also selinexor, bortezomib dexamethasone is something that we can use when the patient achieved the refractoriness to lenalidomide. What about the following lines? Bispecific antibodies are consolidating their data in terms of monotherapy, in which we see solid data in terms of response. Also, the tolerability is improving thanks to the teaching that we are doing each other about the how to manage adverse events, the prophylaxis of patients, that is something really important. And I think that molecules like teclistamab, elranatamab, but also other bispecific antibodies that are on the horizon are something that is game changers for our relapsed refractory patients. CAR-T are something that we have tested not so much in our daily practice, but from clinical trials we are going to see that data are more and more solid. There are other options, other potential sequencing, and I think that also data of real-world analysis are confirming that we need as soon as possible also for our daily patients. And I think that we are going more and more to focus about sequencing. Sequencing is something that should be in the mind of myeloma researchers, because we should find a way to define the right patient for the right drug or combination. And that's why institutions like mine are performing a new generation profiling of the patients, particularly adding new imaging methods such as full body MRI to PET-CT, adding molecular analysis of our patients. We presented in oral communication at ASCO 2024 the addition of new diagnostic methods, full body plus PET-CT for all the patients. In some way, 26% of patients could benefit of a change of their management thanks to the combination methods. we are in some way adding molecular data to this analysis because we are performing Sky92, a new molecular assay to all our patients. The combination of multi-omic project, molecular evaluation, imaging evaluation, metabolomic and the clinic evaluation will be combined, in which will be maybe a potential new prognostic score. I think that the therapy changing as a revolutionary in last years, but we have also to a little bit stop, freeze our running in new developments and to think also a little bit about the diagnostic. Improved diagnostic means optimization of what we have today, means optimization of the discovery of a potential relapse, means optimization of patient journey. Another important topic is the prevention of myeloma. In my institution we are particularly caring about the high-risk smoldering myeloma detection, understanding which are the patients that should be treated. The idea of prevent patients to develop multiple myeloma, to treat before they become symptomatic, is something that should be really a hot topic, a really unmet medical need. And that's why we are in some way doing an awareness campaign in which we want to discriminate between MGUS, smoldering myeloma, and particularly detecting high-risk smoldering myeloma, the ones that should be put in clinical trials. There are ongoing clinical trials that are showing great results with monoclonal antibodies, but also bispecific antibodies. Currently we are enrolling for EMN 34 and anatamab trial for these patients. I think that we should also in some way be ambitious for patients that are not ill in this moment. The endpoint should be MRD negativity. We want to cure them, not only to in some way point on the progression-free survival improvement. We want to eradicate the disease in these patients. So I think that we come back at home from this couple of conferences with many ideas, many results. Myeloma is one of the main characters in hematological malignancies world, and this is thanks to the researchers that are having exciting results in these years. And I think that the cure of multiple myeloma is not so far, and this is the best wish that I give to our patients, to their caregivers, and to all myeloma researchers that every day fight against this strong disease.